Good evening, everyone. Today we have a doctor who is a specialist in infectious diseases with all what's going around the world, especially in RTP, the community that has so many questions on the coronavirus, how to go about with whatever is happening. We have a doctor, his name is Dr. Ravindran Padmanabhan. He's an infectious diseases specialist. He has done his residency from the renowned Cleveland Clinic, and he's working and practicing here in our town, Raleigh, from last 10 years. Good evening, Dr. Ravindran.
Hi. Nice to see you.
Yeah. Thank you so much for joining, especially giving us this time for the community with your busy schedule. We really appreciate it.
Nice to be here. Thank you.
Doctor, can you please tell us some basic information? How did this virus brought the whole world down? Can you really explain to us what happened?
So, coronaviruses are pretty common viruses. There are quite a few circulating, mainly in animals. So, hundreds of viruses really in bats, cats, and camels too. What has happened is there are about 7 viruses that have crossed over, and we call this a spillover phenomenon, when they can leave the animal reservoir and infect humans. So the 3 most, we have 7, and 4 are pretty benign. They cause the common cold. They don't do much more damage. 3 have been much more serious viruses. We know about the SARS virus, 2004, MERS, 2012, and of course now COVID. So there is speculation about how this spillover happened. Of course, it's easy to blame somebody and say, it's this market or that market. But the answer they still do not know. This particular virus has 2 parent strains, if you can call it that. One parent strain seems to come from a bat, and the other parent strain seems to come from a pangolin. So, which are animals that exotic meat is consumed in southern China. So, it's possible that somehow the viruses rearranged genetic material and found the human host and then replicated in that host. Again, this is very speculative. Much more research needs to be done before we can say for sure. Like MERS. MERS, we found out that it's camels. So it transmitted from bats to camels and camels to humans. So before we can establish a pattern like that, it is hard to say the exact route how this happened in Wuhan and how it exactly transmitted is hard to say.
But it's really good to know the 7 viruses, and it's good information.
Mm-hmm.
What are the symptoms, doctor, when a patient sees this? What should they look for?
So, based on once this really hit the news, hospitals in China, especially Wuhan, looked at a big series of patients. Common symptoms were a fever, a dry cough, and shortness of breath. There are some patients who also developed GI symptoms. Some of them did have diarrhea. Actually, the first patient in the US who traveled back from Wuhan developed diarrhea while he was in the hospital. So it is that's one possible symptom. Fatigue, tiredness has also been reported in a fair share of patients. And interestingly, they said there was the loss of smell was said to be, but now they've proven that possibly is not a very reliable symptom. So I would look mainly for a fever, dry cough, and shortness of breath. Those are your 3 main symptoms that you should focus on.
That's good to know, doctor. How contagious is this? Today we saw some news that is it airborne or not? So a lot of people are in the panic mode. So is it airborne, and how contagious is this?
So we do not know that either. The reason this whole WHO thing came up is a batch of scientists decided to aerosolize the virus, meaning leave it in airborne form. So airborne really means there are two ways that viruses can transmit. One is droplet. Droplet is when somebody coughs on you or talks to you, somebody who's infected. And the thing about droplets is that they have a very short life. So if the microorganisms do not get transmitted quickly, then they don't get transmitted at all. Airborne, the problem is that they initially start off as a droplet, but once the outer core or the outer membrane of the droplet evaporates, the microorganism stays in suspended form and can stay for much longer periods of time. So that is the quote unquote danger. The scientists, they then also tested how it survives on inanimate surfaces, copper, on plastic, and I believe they aerosolized it. What they found was that the concentrations when they put it in aerosol form did drop over time, but it was a good 3 hours before it dropped off. So different hospitals now have different recommendations. So the CDC says airborne. So the whole clinical implication is, what do you do to a patient who you suspect of? So do you put them in droplet precautions, which is just a mask, or do you put them in airborne, which is also a more specialized mask and automatic placement into a negative pressure room, meaning the bacteria or the virus is just sucked in to the atmosphere and it has no circulation in that room at all. So, of course, that has a lot of cost implications. As you know, we are probably running out of N95 masks pretty quickly. We are going to run out of them.
Right.
And as of now, the broader thinking is this is in all likelihood airborne. I'm sorry, droplet transmission. And in Bateman Hospital, we now have the policy of using droplet precautions only. We use airborne if the patient is going to be intubated, if they're going to have a procedure on their trachea, or if there's any chance that any procedure is going to be done on them that will aerosolize and potentially make this airborne.
Right.
So for very restricted indications only, as of now. On the other hand, Duke Raleigh has a policy where they're using airborne precautions in addition to droplet and eye shield. So different hospitals, even in the same city, have kind of different approaches to this. As of now, I would not worry about what something gets sent on WhatsApp. It probably has little clinical implication once you hit the hospital door.
Very nice. I think that's so refreshing. Thank you so much. I think a lot of folks had questions today on the airborne. Thank you for clarifying that. So how are these virus cycles? How long will it take? And a follow-up question is, we are heading into summer and spring. Is this going to die with extreme temperatures, or can you throw some light there?
So we do not have enough data again to call this a hot weather virus. MERS thrived in the desert environment, camels in Saudi Arabia, people who went to Mecca brought it back. Again, it is too early to say without having had a proper test situation. So there are cases in Australia and hotter climates. Singapore has not reported too many cases, even though it's summer in Singapore. So we really do not know yet whether this virus is going to just be relentless and last all summer long, or whether the temperature is going to make it die out quicker. So it is a chance, but again, we have no control over it. So there's no point speculating and worrying about an imponderable.
All right. And the follow-up thing, what I think the community is looking to answer is, what type of research is happening? Are there any treatments? Are there any medication? Did FDA give out some medication for this?
Right. So We have 3 or 4 agents. The promising agents are there is an agent called remdesivir, and there is one trial as of now being conducted here to see how well it will work and whether it can be recommended for use routinely. Right now, we do not have the numbers to test it on. The problem in this kind of a pandemic situation is that you're going to have trouble doing a properly conducted trial. You're not going to have a very good chance of randomizing patients, meaning you're not going to have controls. Most of these studies are open label, meaning the investigators knew exactly who was getting what drug without having been blinded. So that causes a lot of bias when results are reported, when how data is collected. So Kaletra, which is a HIV AIDS drug, was studied in China. So at the peak of the epidemic, investigators managed to recruit close to 200 patients and study Kaletra when it was given, and they even managed to recruit controls, which is quite a feat. Unfortunately, Kaletra in that trial did not improve outcomes at all when compared to the controls. People are talking about chloroquine, hydroxychloroquine, with or without azithromycin. Again, we do not have enough data for saying that should be the way to go. Whatever is coming out is out of very small populations. The French study for black hydroxychloroquine had about 30 subjects. That is, I would not want to be on a drug which has been tested on 30 subjects unless it is a Hail Mary situation. So right now, I think the way going forward is to, if we have a very sick patient who we have tried everything and we have not had any success and the patient is really not doing well, we will ask the FDA for compassionate provision of remdesivir. That is all we have planned right now. But in a sick patient, when nothing is responding, will doctors try medicines like this? Absolutely. But that does not make it legitimate or a tested principle. So I would be very careful what I read on social media. People are reporting protocols for prophylaxis, which is drugs for taken when you don't have the disease to prevent it.
Right.
And that to me is quite. I don't know what to say. It is really not. I do not think it's going to make any difference. The other problem with these is people will always report the positive results.
Right.
How many hundreds of patients got hydroxychloroquine or chloroquine and didn't do well or died? We do not see the negative reports come out in the press because it doesn't generate news. Even if one case is successful, quote unquote, with hydroxychloroquine, they're going to be reporting all over the place. So you have to be careful what you read and be very selective about even reading anything on social media.
I completely get what you're saying, but do you see something like a FDA-approved drug coming soon? Is there a time or?
We could see remdesivir based on the results of that one trial.
Okay.
I think that is my personal opinion. The other agents, I'm not so sure about.
Yeah, thank you so much. At least there's a drug name where at least folks can connect and look forward for that. Other thing, what every other person in the community is doing, what we can do personally at home. What are the home remedies we can try out to keep our immunity system strong? Can you throw some light there?
Eat well, sleep well, and exercise well. I think those are your best home remedies. I do not know of any, quote unquote, from an Indian standpoint, home remedies do anything different. Ginger. I have no idea. I don't think that there's anything that I have heard of that's going to help with just common sense, I think.
Yeah, I think sleep well is what I think we should take away. You all are at home, so I think that's one good thing. Take some rest. When should patients seek medical attention? When should he call his doctor, or what are the steps when these symptoms come about?
So the CDC website enlists symptoms where you have to be a little bit more careful when it's probably much more serious than the usual COVID infection. One of it is worsening shortness of breath. Shortness of breath that just doesn't go away. That could indicate serious lung damage, and that's when you either call your doctor or you talk to your primary care provider or 911. The second one is cyanosis or blue lips, blue face, which means which is indicative of you not getting enough oxygen. So that is a problem. The third symptom is mental status change. So if your relative is acting a little bit more confused and they're just not themselves, in addition to the fever and the cough, then that could be a worrisome sign. Again, not enough oxygen to your brain, and those are probably times when I would pick up the phone and call your provider or 911.
Perfect. And locally in our RTP or Raleigh, Durham, Cary, where should a patient go if they want to get these tested?
So if you already have a primary care provider, I would strongly recommend you call the primary care provider. You call the office, and every office should have a protocol about how they're going to deal with these calls, who is going to get tested, and who is going to be asked to come in or go to the hospital. So we have Bateman Raleigh, for instance. We have a number that the patient calls, or if the patient is already in somebody's in a doctor's office, a Bateman doctor's office, they have a number to call. That phone is that service is a person will answer your call, and they will triage you and determine whether you meet the criteria for testing. Every hospital system here, Rex Hospital has a phone number, Duke Raleigh has a phone number. If all else fails, and let's say you're uninsured, for instance, NCIAP also has a number which will be answered by a physician, and then that again the same pathway, whether you meet the criteria for testing. Once and hospitals systems have various avenues. For instance, Bateman Raleigh has a diagnostic respiratory center. It's called the DRC, and they are fielding about 50 to 70 patients every day based on that number, that phone number. So that phone number for Bateman is 919-350-5250. So likewise, Duke Raleigh has its own number, Rex has its own number, and so based on these systems, you can call that number. I think that would be your first go-to number.
Perfect. And NCIP is doing a fantastic job outside of this, and I'm glad to know you brought that name up. And what we will do end of this presentation, we'll just put a slide with all the numbers we'll take from doctor, and then that will be an information for all of you as well. Moving forward, doctor, if assuming a patient is detected, what precautions he or she should take to make sure that's not getting spread? Being in the family, you have a family member, you have a home to live, how does that work?
Again, I would refer you to the CDC website. There's an excellent patient written in layman's terms about what to do if you are sick, what to do if a family member is sick. So the basic principles are: isolate the patient, keep them in one room if possible, the bedroom, and preferably with an attached bathroom. If those are things that you can achieve in your household. If not, I would definitely keep one bedroom for that patient. The second recommendation, again from the CDC, is a mask when you are taking care of the patient, and a mask for the patient as well, especially if they're going outside. Say for a doctor's visit, that patient will have to wear a mask. I would not share any utensils or silverware. I would dedicate some for the patient alone for the period of the illness, and I would quickly wash those utensils. Laundry, again, ordinary laundry detergent is perfectly fine for this virus. In fact, that's what Wakeman and Rex are using. They're normal to launder their patient beds and bed sheets. Those would be the major principles to stick with. But I would read the website, the CDC web page, especially where it says caring for a sick one at home.
Yeah, this is such a good information you gave, doctor, because assuming someone in the family is infected, they can still have a room with a restroom, and others can still live and coexist in the same house. In that way, the whole family is not getting into some jeopardy. So that's really helpful, and definitely there will be other inputs given too by the medical teams as well. But coming out of that, again, going back to the regular population here, are there any travel restrictions? Should they just, of course, it's just some folks have to mandatorily travel. Is it all standstill? Should we stop all that?
I think at least, yes. I think at least for the next 2 weeks. The State Department, your State Department it's a level 4 advisory now. So they're discouraging any and all international travel.
And domestic too.
Yes, and domestic too. So I think that's an excellent idea, at least for the next 2 weeks, until we have a better grasp on how this is going to, how many more cases we're going to have, how overwhelmed the hospital is going to be, how sick are people going to get. We are still in the very early stages, I think, and I think if you can at all avoid travel, I think you should avoid travel for the next 2 weeks, and possibly for the next month or two. I think that's what's going to happen.
Perfect. So they stay back. So what's social quarantine? How does that work?
So when we don't have a vaccine or a cure, and we are in a pandemic situation, the only things that have shown to be effective is social distancing and isolation of the sick patients. Those are two principles. This is nothing new. People have done it for ages. The cholera epidemics, typically, this was what was called for in the days when they didn't have treatment for cholera. So what I would recommend is practice social distancing. It is not easy, especially with the kids at home. It is very difficult to enforce it. I would things are going out, I would avoid it. Again, like I said, if you take it on a week by week basis rather than saying I'm going to be in my house for the next 6 months, it makes it easier. And a lot of conversation with the kids, I think, helps. Sharing information with them, perhaps a podcast from a trusted source, so that even the kids know that this is no longer a punishment or an imposition. It is a social public health exercise.
Right.
So what we're trying to do here is the issue is not getting sick yourself. The issue is not infecting the third or the fourth person, who could be an 80-year-old with asthma, in whom it could be a fatal infection, and you don't know who you're going to pass it on to.
Right.
So I think for now, social distancing is probably one of the important tools, and it should be regarded a public service.
Definitely. So with all these things going, there are small businesses who are still running to keep the community running, like the grocery stores, the local businesses who are giving food to go right now. Of course, the restaurants are closed, but they give to go food. So what type of precaution? Because they will still be interacting with so many people, they are looking for answers to. Can you suggest what type of measures they should take as they help the community in this dire times?
Minimize time with the customer and maximize distance. So what certain businesses are doing is actually some of them have an email where you can order what you want. It'll be bagged for you by the time you go there, and you just pay for it and walk out with it.
Sure.
I think those are excellent measures because again, these are things you cannot avoid. You run out of things, you need to go and do your grocery shopping. Lots of stores have implemented their own forms of infection control. Many of them are still maintaining a 6-foot distance. Somebody is doing the bagging, and you stand at a distance, and you go collect your bags, and you pay, all the while maintaining a 6-foot distance from the others. Other businesses are limiting the number of customers they let in at any one time. But again, two simple things are minimize time, maximize distance. I think those, in these uncertain times, I think those would be what businesses should be doing as well. They also have cleaning protocols, how to disinfect your own homes, your own businesses. Again, the CDC has an excellent, I do not know the names of each reagent or disinfectant, but you can do a lot by simple measures like wiping down high-touch surfaces. That's the other thing I forgot about these, caring for your sick one at home. High-touch surfaces, if you there is a list of approved agents. I believe Clorox wipes are one of them. Counters, doorknobs, toilet seats, drawer pulls. If you can wipe them down once a day, that will help a lot. In addition to, of course, I would recommend washing your hands at least 4 to 5 times every 3 hours. So at least every 4 to 5 times a day, soap and water or even the hand sanitizers should work.
Very nice. Yeah, especially all the small businesses who just heard, you're keeping the community run by keeping your shops open, like grocery stores, restaurants, all those folks working in CVS, pharmacy or other pharmacy stores. I think this information is so helpful. Keep yourself healthy so that you can support the system for the next 2-3 months. Doctor, you touched on the medication. Can you throw some light on vaccines? I know it's a little far away, but is something coming?
So making a vaccine also has challenges. So sometimes there are vaccines made that target the entire virus. Other times, so this particular virus has 4 structures that could be potential targets. And the question is whether we use one of those called subunits to build a vaccine, or whether we just make the virus a less dangerous virus, so that you can attenuate the virus and make it a live attenuated vaccine. You can target the whole virus, or you can target these 4 regions, body parts of the virus. Whatever said and done, I do not think we're going to have a vaccine within the next 6 months. 6 to 9 months it will happen, but it's not as easy as people think. It's just not. You just don't inject it in somebody and say it's going to work. Again, safety. What are the side effects? And is what we're doing, is the part of the virus we're targeting helpful? So those questions need to be answered, and it's probably going to take 6 months or so.
Right. I think we touched most on a lot of the questions which community had. some predictive modeling. How does the next 2 weeks, 1 month, 2 months look, doctor? Can you just, I know it's tough, but can you paint a picture at least that way? The community sees that, okay, this is what's coming, we should be ready for that.
So there are predictor models, and there are all kinds of numbers which predict everything from a doomsday kind of picture to somewhere in the middle, to the virus completely dying out at some point. We do not know where this trajectory is going to be. Could we reach an Italy-like situation where 500 beds in a 1,000-bed hospital are occupied by COVID patients? I don't think so. We are slightly ahead in this ball game. I think we got in a bit earlier than Italy, and I think we are most. When I look at hospitals today and the streets and even some of the grocery stores or I go to, there is a lack of people there, which is a very good thing. I think we are doing a great job socially distancing, and the more we can encourage that to happen while we have these other pieces of the puzzle being assembled, I think we will have a better chance than Italy of doing a good job with this virus. Again, we have no control. Really, if you look at it, we have no control over this. It is out. The cat's out of the bag. So you cannot sit down and think, oh my gosh, is this person am I going to die? Am I going to get infected? It is impossible. So what you can do is take a real global view of this. Trust the clever people to come up with treatments, with vaccines, with due time. Limit social media. I would strongly recommend not looking at notifications every 5 minutes, because that fuels a lot of anxiety. I think as a community we just need to calm down and take a deep breath and say only time will tell.
That is so wise advice. Please, I think you all heard. Get out of those WhatsApp, try to calm down, give a positive impact to your friends and community as you speak to them. That's going to change. And you being in this disease infection practice, you are in the heart of the game, and you are so much sought out, look forward for. Would you like to come back again after 2 weeks to again give an update to the community?
Sure, yeah. If we have more information, then we can update and say these are the facts now, and then 2 weeks from now we probably have better numbers, more data, and we probably will have much more concrete information.
Perfect. Thank you so much, Doctor, for your time once again.
Thank you.
Appreciate your time.
Thank you. Glad to be here.
Again, as you all saw this, folks, for you to protect yourself, you have to protect first yourself, do that social distancing, take care of your family, take care of your bigger community, and take care of your town and the country you're living in. So it all starts with you. So be careful, and this is no big panic. If you just stay home, be calm, and do your things, everything is in the running mode. So keep it in that way. Until we meet next time, you all have a good, safe, nice time with your family. Thank you.